your patients that present with a talus that is in a posterior position, this is a great technique for them. Now, taluses can be in a posterior position for a number of reasons. They may have had, usually what's happened is that they've had some type of sprain or strain or impact activity where they've landed on their feet from a height that has caused a lot of ligamentous or soft tissue insufficiency to be created through the posterior aspect or the anterior aspect of this lower extremity. In any result, they've come into your office and you can feel the distal shelf of the talus, but you can't feel, or the distal shelf of the tibia, but you can't feel the talus at all. When you go to palpate behind, you can actually feel far more of the talus in between the tibia and the Achilles tendon than you should be normally able to palpate. So our goal with this is to, again, get this talus more into a neutral position. Now, in the previous video you saw with the anterior talus, we had the foot off the table. With this position, we have the foot on the table, and we are also incorporating a block in order to gain some elevation so that we have some control in establishing this talus more into a neutral position. So with your patient's leg in this position with the calcaneus on the talus and the foot in as much of a neutral position as possible, what you're going to do is place both hands over top of their tibia, and you're going to slowly press all of your weight down into the floor or into the table so that you cause this tibia to be positioned more posteriorly, allowing this talus to be drawn in an anterior position. So again, have both hands very gentle over top of their tibia. You're going to load your weight down into the table, and that is going to draw the tib and the fib posteriorly, allowing that talus to be drawn more into an anterior position. So let's see what this looks like with our patient. Okay, with your patient lying face up on the table, you've taken a foam block and you've placed it underneath their calcaneus. Again, you've assessed already to make sure that you can't feel the anterior aspect of the talus. You can only feel the distal end of the shelf of the tibia. So with this position, again, you want to have the foot in as neutral of a position as possible. Feel for the talus that you can't feel with your index finger. Feel for the distal shelf of the tibia. Again, gently placing your hands over top of their tibia. Now, with some people that have had a lower extremity injury, it can be very hypersensitive through the anterior aspect of this tibia. So what I would suggest is that you can place a towel or a thin cervical pillow over top of the tibia between your hands and their skin so that you minimize the amount of hypersensitivity that is going to be created during this technique. So again, hands on the tibia, foot's in neutral position, and what we do is we just gently increase our compressive forces through the tibia, drawing the tib and the fib posteriorly into the table, which allows more of an anterior position of that talus to be created. Now there may be a little indirect rocking back and forth that's created. Again, this is just the talus wiggling itself, effectively wiggling itself into more of a neutral position. When everything comes to a halt or a balance, and there's no more internal or external rotation of the tib and the fib, everything becomes to a balance point, and it feels effortless to stay here, then the technique is done. Now, one thing I will say is that if you have a patient who has an anterior talus, this technique can also work. Now, the reason for that is it's effectively similar to when you're in your kitchen and you try and remove a utensil from a drawer, but the drawer gets stuck. Usually what we do is we slam the drawer back into place, we jiggle the drawer around to rearrange the utensils in the drawer, and then you can slide the drawer open. It's a lot more easier. Well, this effectively works the same way. If we've got a talus that's sitting anterior, sometimes with some patients, taking that talus more into an anterior position allows everything to unlock through this mortise joint, and then you can actually progress into the anterior talus technique in order to mobilize it more into a neutral position. So try this technique with your patients. Again, it can be used for a talus that's sitting posterior or anterior, and see how you do.